This conference will now be recorded.
Everybody, okay, let's start. If anybody's still wanting to come in, they'll come in. So, where do y'all want to start? What do y'all want to do? Because I've been wanting to start something, and I've known a couple of groups in the Slack meeting have started their own projects. But is anybody here in any of those groups that have started? And if so, where are you at with starting?
Can you hear me? Okay,
Yes.
great. I guess I had a question. I was wondering if we could get a little more like clarity on, I guess, what exactly are you looking for? Are you looking for like a page long like description of like our plans or what we're thinking by like the end of next week? Are there any upcoming deadlines, or is it kind of up to our individual groups on how we want to approach things?
Right now, we're still trying to get everybody in their assigned groups and making sure that everybody has a topic that they are interested in. And if anybody has other suggestions, you can always add them. But as for the actual research itself, we haven't started anything that's coherent yet. We are still getting everything together, so we need to have all the CVs in by Friday,
Oh,
so me and Josh can get the leaders together.
I just
That
joined.
way we can That way we can have somebody leading each topic, and that way the topics can start organizing and having their descriptions and summaries all together. But eventually, we'll have it to where there's a deadline for each topic to have some type of article, either one by one, summarize and analyze, and then submitting those articles, or having the infographics. If you're doing the infographics, you'll have certain parts of the infographics that you need to start setting up. So each topic choice is going to be more individual to those in the topic group. So it's going to vary between topics. Does that
Hi,
answer
I
your
have a
question?
question. Oh, I'm so sorry.
Go ahead.
I have
No,
a
you're good.
question. Because I just joined today. I'm relatively new to the group, and I was wondering how we can propose new objectives, new ideas for projects that we want to pursue.
So you can always email us at the researchersforchange@gmail.com. That's a good way to do it. You can also just submit it to the group chat, and then we'll eventually see it, and then we'll see if we like the topic. I mean, all topics are pretty much going to be added if it's something that could be worked with, because we have a lot of people, so there's a lot of manpower behind every topic that could be started up.
But like, where do we start? In what group do you mean? Do you mean like the one in not like a group chat and WhatsApp, right? You mean like um yeah, because I joined today and I'm like a little bit, where to start.
So do we have the group me also on the website? We may not even have the group me on the website yet. We have a group me going, and that's where most of our conversations are going. Now we have the Slack going on, and there's a social center that I added to the channels. It was the general channel, but if you want to submit your ideas there as well, those will be seen as well.
I think I could do the group me because I haven't been added yet. I just found out about right today. So I joined today and it kind of just went, uh, I worked on my homework for a while. Like, right now I'm joining, but I didn't get to do the group me. And,
Okay, we'll add a link to the website so we can get everybody to jump on the group me as well.
thank you.
Mm-hmm. And did that answer your question from earlier about the summary pages?
Yeah, I was just kind of confused. I just wanted to know, I guess, like, what do you expect from us right now? Because I totally get like you guys are just starting everything up, so like we're ready to be patient and let that kind of process like go along. But is there anything you're expecting from us right now, or is it more of just kind of like a wait and see situation until you have the members and leaders where you need them to be?
It's more of a wait and see right now, to be honest with you, because if we start it right now and everybody's kind of spread out and we don't have specific topic leaders, it's going to just end up getting jumbled and everybody's going to be a bit different in where they are with their projects. So if we have the leaders set up, then we can have somebody that could take a hold of a couple of the topic sections and make sure that they're following a good schedule, and those that are related to each other can work together and cooperate a little bit more. And if we
Okay.
start it now, then that might not happen.
Yeah. Okay, that makes sense. Thank you.
And for the group finding research articles, we are currently looking for articles regarding mask efficiency. Right now we have about 5 articles, but how many do you think we should get by the deadline? I don't think I've set a deadline yet, but 5 articles is a good start for now. If you're talking about the CV deadline, I think that since you guys are the article sifters, basically, you can just keep constantly going through articles. I would say maybe 5 a week, or about 5 a week would probably be a minimum that we would have for you guys. That way those articles could be picked up by the other topic groups and they could be used easily, and they don't have to go along searching through all the different databases for different research articles themselves, and they already have the good ones that y'all have picked out and probably already summarized to some degree.
I had a question.
Go ahead.
So if you're in like one of the groups doing infographics for like one of the different areas, I know that like we're trying to combine the groups doing like the research with the infographic group, but because obviously infographics have to wait until there are stats to put on an infographic. So do you want us to kind of merge those duties and have like infographic people work on finding stats until there's enough stats to start putting something visual together?
That would be great if y'all could take that initiative and then combine with the people that are doing the articles. That would be great for the speeding up the process when we eventually get the leaders assigned to the groups.
Mm-hmm.
What I wanted to talk about today was, aside from all your questions, which are very appreciated, we need to straighten everything out. We need to start getting onto this, because I know a lot of you are probably getting antsy about the research and how this whole group is going to work when it gets set up. So I appreciate all the questions. That way we can comfort people a little bit more. But today I was thinking, I mean, you've seen it on the news how the masks are starting to be a bit more in the news, and saying that people are saying that we should be wearing them more. So I was hoping that we could have those who are doing the mask efficiency article or efficacy articles, the ones that are sifting through them right now, and the ones, do we have any of the group from the infographics regarding the mask efficacies? Anybody from those here right now? Nope. Okay, so I don't know who all is here. So does everybody here have a topic choice that they're in right now for Slack or for the spreadsheet?
I am not. I wasn't able to add my name to the spreadsheet, and I'm not, for some reason, I tried on my phone and my laptop, but it won't let me.
I'll look at the spreadsheet to make sure that everybody has access to it. Let me do that real quick right now.
I had access to the spreadsheet earlier and I added my name, but I don't really have a group right now. I literally just joined about like 3 hours ago. But I do have a topic in mind regarding the discrepancies in socioeconomic statuses and their relations to COVID-19. How would that work? So how can I get people to join my group?
So I think we actually have somebody that is already looking into that as well. And let me double check because I know that I don't know how to say names, so I'm sorry, but it's Lourdes, Lords, I want to say, but I'm not sure. She was looking into.
Wait, I heard my name.
Hold on, let me find it back. You were looking into the socioeconomic disparities, correct?
Yeah, for the health disparities, yeah.
Yeah. So Zanib, right? That was who was asking about that.
Yeah,
Mindy.
Zanab.
I don't know if it's going to be a tangible prize or in your heart, but there will definitely be a prize to be announced tomorrow. Stay excited.
Are you talking to me or her?
Whoever asked about the disparities who just joined like 3 hours
Everyone
ago.
has something to
That was me, Mindy.
Oh, okay. So you want to get with Lords because eventually we're gonna have Josh that comes back because he's the other co-commander here. He's a MD PhD candidate and he has connections with our college, Texas Tech University, that with people that are already entered into that research topic in themselves. That way, you both can get into a topic group and then y'all can start working on it together. When Josh
Thank
comes back.
you. Thank
Yeah.
you so much.
Yeah, I also have another girl with me that messaged me in regards to participating with health disparities. So if you guys are interested in that, please message me on in the group me, and then I'll try to keep names down in case we solidify this and try to form a subgroup, and I can get all y'all participating in this research.
Okay, I gotta go back through chat real quick to see who all responded, and it's not letting me. Oh, there we go. Okay, we have a couple people that already have topics here. So for those people that don't have topics, that's what I was gonna do earlier. I'll check the topic schedule or spreadsheet rather.
Does each topic max out at like 5 people? Because I noticed that like some of the topics, like there was like 5 slots or whatever, and then like each one filled up, and then there was some with more spaces.
Right now, we just have them as 5 persons per topic. That way, we don't just have excess people on each topic. We might increase it eventually, depending on if that topic needs more people or not. But for right now, we're just going to keep it at 5, and that's why we're wanting more topics to be shared, like the the socioeconomic disparities. There's a lot of people on the spreadsheet right now, so I think everybody can edit it right now. And I'll put in our chat right now our website. And then I'll put the spreadsheet link.
Hey, Malachi.
Go ahead.
So just to clarify, is it okay now if we start making channels for our 5-person group on Slack?
Yes.
Okay,
If
sweet.
you don't see the channel already there, you can go ahead and create
All
your
right,
own channel.
sweet. Thanks.
Then I'll share the link to our group me chat. That way everybody had access to that as well. Maybe. I'm always scared going into the group me chat and accidentally hitting something that just deletes the chat completely. Oh, that would be so sad. Okay. So if you're new, if you're like brand new, the website has our basic information on there. I would pay special attention to the disclaimer so you know what this group is and what we're aiming for and what you're getting into. And the group me, we have how many people is it at now? Like 200 and something, 240 something. We have a lot of members in the group chat, so that's already good. Thank you, Staney. Appreciate it. Now the group chat is on the website, so everybody should be able to see it that joins and has the website available. Okay, so are there any other questions that y'all have right now?
Yeah, so for joining now, are we a founding member or no?
No. So
No, not now. The founding members would be the ones that joined on like the 18th or the 19th. So right now you would just be a regular. You can still put your name in the member group, but we're gonna go through and highlight everybody that was here already. That way we know which ones are which, and everybody can say if they're a founding member or not too.
You're cutting in and out.
Oh, did okay? What did y'all hear me say then?
You said the founding members were the ones that joined on the 18th and the 19th.
Yeah, that was basically it. And we're gonna
Okay.
go through that and make sure that we highlight the founding members. That way we just know who's who. Do we need to send our CV? Go ahead.
So
Sorry
where can
about
I
that.
find this spreadsheet?
I didn't hear you. What'd you say about the spreadsheet?
Where would it be found?
So on the website that I just posted, our website, it would be in the important links.
Okay.
And then you would go to the Google Drive, and then all of our forms are in there.
Okay, thank you.
And somebody else wanted to ask a question too.
Yeah. So are we only allowed to do one topic at a time, or can we participate in multiple ones?
Right now, we want everybody to just sign up for one topic at a time. That way, there are more spots for everybody since there's so many people. Eventually, we might be able to have people sign on to multiple topics. Like the leaders would probably be signed on to multiple topics if we don't have enough leaders for each individual topic. But for right now, just sign up for one.
Thank you.
Mm-hmm. So do we need to send our CV if we're looking for articles to be used in the published synthesis but not directly contribute to writing it? No, I would say not unless you wanted to get into a leadership role, have a chance to get into a leadership role, or have a chance to actually get into writing the synthesis articles.
And where would you send your CV to?
Here, I'll put it in chat too. Here's our
Email.
If you send all your CVs to that email, we'll be able to get them. So if we can get enough leaders, we will have a leader for every topic. But if we can't, then we will have to just take the leaders that we think would be appropriate. So it's not really set in stone right now how many we will be taking. And I have to discuss this with Josh.
Sorry, do the topic leaders, do they need to have previous research experience?
Yes, we would prefer people with previous research experience. That way, if somebody is in the topic group that doesn't have research experience, they can communicate with the leader and be able to establish a good background for what they're doing.
And in this case, when you say research experience, does have what kind of do they have to have a publication or as long as they did research?
As long as it's like undergraduate research or something that has been published. Published would be higher valued for us right now. But if they don't have a publication, if they have undergraduate research and they have like something that can show for the undergraduate research, that would be also sufficient to.
Okay,
submit.
out of the ones on the Google Drive, which one is the spreadsheet that you were referring to? Because there's like 5.
For the topics,
Yes.
it would be, let me look. It would be the one that's titled COVID Research Group Task Tracker.
Thank you.
What are you looking for in applicants for leadership? Okay, for that, we're looking for, once we get the CVs, we're looking for people who have experience. So people with publications would be more sought after than people who just have an undergraduate research experience. In addition to that, we would want somebody who possibly already has leadership experience. That would also be helpful towards collaborating with all the groups that they have under them. And really, I really want some leaders so I can have some help for things like these, so I'm not lost with all the questions and trying to catch up with everybody. That would be helpful, and we could look a little bit more professional. And another thing, I have the deadline set for Friday, and I'm hoping that that's a relatively quick time because earlier in the week I was talking about I think it was Sunday. I was taking graduation pictures, so that's why I was MIA for a little bit. But during that time, I was talking to a PhD professor at my college. He's a part of the, and I posted all this in the group chat, in the GroupMe chat. He's a PhD professor in psychology department. His name is Dr. Roman Taraban, I think. I can't remember how to say his last name. I'm very bad with names. But he is very interested in the group, and he liked the whole aspect that it blew up so quickly. And we had at 200 members, I think, at that point. And he is saying that we could probably do a collaboration with CISER. That's what it's called, CISER. His whole organization. They have a whole website as well. And I'll post the email again in the GroupMe chat so that everybody can take a look at it. But their website is like a professional college level website, and he said that we could probably end up collaborating with them and start setting up more professional forum discussions and collaborations with their whole program. And their whole program takes into account a bunch of different fields, so it's not just COVID, which is what I want this organization to eventually go into, is a bunch of different fields and not just solely COVID. I know a lot of everybody here is wanting to go into medical school, or they're pre-med, or there's something with healthcare related. And I know a lot of people are solely interested in that, but a good, well-rounded person also has a higher chance of getting into medical school. So those who take interests in things outside of medicine also are seen a bit more well by admissions.
I have a question. Out of those, the spreadsheet that has like different little colors, like orange, very light orange, yellow, those like different color coded as topics. We can only pick one from everything, right?
Yes, one from everything. Yeah.
Okay. And when it says person 1, person 2, it doesn't matter. It's up to like 6 persons, right? So if there's still room, you can still do that. Is that what it is? Okay.
Well,
yeah.
I think every group should only have 5 people in it right now. So I think that's what we listed for it. I don't think there's. Yeah. Okay.
Okay. Thank you.
So somebody asked if we communicate using GroupMe or Slack. Right now, we're still on GroupMe. We hope to eventually get everybody onto Slack, but since most all of our members are still on GroupMe, and it's like divided by half, I think. Half of our members are still on only GroupMe, and then half are on Slack. We want to wait until everybody, or most everybody, gets onto Slack before we start solely communicating through Slack.
Okay, well, I have a question, right? There's like this column that says waiting for people to sign up. What does that mean? Like,
so is that for the synthesis here? I gotta look at it to make sure I'm looking at the right thing too. Is that for the synthesis paper?
no, that's for creating a list if known, yeah. It's like from the very from bottom to like the top, it's like the fifth.
I have a question. So,
Go ahead.
have you thought of doing a LinkedIn?
I don't think we've talked about it yet, but I'm not really familiar with LinkedIn myself. So if y'all want to do that, we can surely do that and add it to the important links as well. And what you were talking about earlier about the spreadsheet, that the status is just saying that we're waiting for people to still sign up for it. Right now, we need to update it because we haven't hit it for a while. But since we have all those topics full, we need to take that off. And that status is just, it's like a placeholder kind of. That's to say that if that topic has begun doing their research or doing whatever they're doing, and or if they're still waiting for people to sign up for it.
Okay, because the one that so there was already the one that I signed up on, there was 6 persons there already. So I just wanted to make sure that if I signed up under that column, does that mean that I'm not in there?
No, you're good. Just think, whatever. I wasn't sure if it was 5 or 6 people to a group, but it is 6, so 6 is good still. If you're in 6, you're good.
All right.
I have a question.
Go ahead.
So one of the tasks is to letter campaign to politicians supporting masks. Can you elaborate more on that?
That was one of Josh's ideas, I think. I'm not too familiar with what he was planning with that one, but I'm pretty sure he's saying that we want to have a group of people actually physically writing real letters and just starting to send them to each of their politicians, like the mayors, the governors, the senators, all these people. So we could try to push for that we are in support of like a bit of a mandate type of thing, where people, or at least better awareness of masks, so that people would start wearing them more.
Yes. Okay.
Hi. I wanted to add on to that. So I'm actually currently interning for a politician for my congressman. And I was wondering how can I connect with you guys on that, because I work really closely with him, and we can potentially work something out. So who can I contact in terms of political affiliation with like mask essentials?
Could you type that, because part of your mic was cutting out, so I didn't get all of that.
Yeah, I'm so sorry about that.
And so somebody.
I had a question. On the document, there's a list of questions, of topic questions. One of them I'm kind of interested in, but I don't see it on the spreadsheet. Is that going to be added? Are you going to add all the topics on the sheet soon? Okay.
Yeah, we'll add the topics on the sheet as well. We started with the Slack. We try to get more topics on the Slack, because that's where we're going to go. The first thing we started with was the spreadsheet, so that's probably, it needs to be updated with all the topics that we have now. Just like there was a division between the infographics for statistics in the U.S. and then articles relating to those statistics. We ended up just combining those groups, so we need to still do that on the spreadsheet. So somebody asked about LinkedIn. I don't know what LinkedIn is. I've never used it. So who's good with LinkedIn? I don't know what that is.
I can try to do that.
Yeah. Also, real quickly, there is a LinkedIn channel on Slack, so whoever wants like to connect, just put your LinkedIn links into that, so we can all do that.
And if you wanna do that, you wanna take initiative and do that yourself. Not what he just said, but about the LinkedIn, creating a LinkedIn for the organization. I would greatly appreciate it. I don't know what that is.
So basically, it's just like it's actually really good because it's a profile where you can like network with other people. And there's like a lot of doctors. I know there's a lot of PIs there as well, so it would be really great to like try to track mentors that way.
That'd be great. That would be very great to get more mentors. That's what we really need right now is a lot of mentors. That's why I was talking to the PhD psychologist. We got to get more mentors if we want to have more ability to have more review papers going on and a higher chance of them being published. So more mentors is always good. Always good. Dima, I think that's how you say your name. You asked if we have a paper, if you would like us to send it with the CV. What do you mean a paper? Like a research paper? Like if you have something that you've already done? Is that what you were talking about? Yeah, if you'll send like anything that you have under your name, like any publications or any papers, anything that you've worked on, it would be good to send that with the CV. That way we have something to reference and be able to look at to help us judge whether or not
On the email,
you would be good
we
in a
can
certain
send it
position
through
versus
email.
another. Yeah. So Mindy asked if in the future could there be a possibility of establishing a presence on social media platforms such as Instagram and Facebook, etc. We have started to do that already. So we have a page on Twitter, we have a Facebook page, and we have an Instagram page for our organization. And now we're just waiting to have actual data and infographics that we could submit to those pages. That way they could have a bit more influence and grow a bit more. So we do have that going on already. Oh, Henry answered that already. Okay. Yeah, I should have read more. You also asked who you can contact to elaborate more on the topic of mask mandates. What did you mean by that? Like which one of us, like me or Josh, or
Because I currently work with the congressman, and you said something about talking to political leaders regarding the importance of masks within today's society of like COVID and everything. So I was wondering how how can I contact you guys if I have a congressman who's ready to kind of give a statement and um, advocate for mask mandates?
that would be great. That would also be very great for raising awareness and outreach for our program. So I I'm very happy and I feel lucky to have you in the group too. So if you want to contact us, you can use that email, the researchersforchange@gmail.com. Any type of questions that y'all have, any type of forms that y'all want to submit to us, anything like that, anybody that you want to get us into contact with that you think could be helpful for the group, you can email that to that email and we will see it. We will get on it. We will start trying to network ourselves and introduce everybody to the group as it is.
Okay, thank you.
No, I don't think there should be a age limit for the leader. I mean, if you're under 18, it's not likely that you have research experience. So in that same sense, it's not likely you would necessarily be picked to be a leader. But I mean, anybody can be a leader. I mean, I've never thought that this would blow up as it was and as it is, and I didn't think I would be in the leadership position right now, but here I am. So Henry, email me and I'll give you the password and everything for that's similar to everything and we can get that set up. Yeah, I think Zoom feels a little bit better. I think it's a little bit more consistent too. Yeah, yeah, we'll go back to Zoom. I just didn't think about me still being in college because I'm still taking courses. Like right now, I'm taking physics 2 for summer. And I didn't think about them having a Zoom, and I would have did it through them if I had been smart enough to think about that. So I have some topic ideas for everyone. I know we've been in the group chat for a while and y'all have been listening to me ramble, but I was thinking of different ideas, listening to like different news outlets and everything. And I haven't cross-checked to make sure that all these ideas haven't already been submitted for the group. But I wanted to look into like transmissions without symptoms, like those who don't show any symptoms, that don't have anything that is really notable about them. What percentage of those people can still transmit the virus itself? And yeah, asymptomatic. There you go. That's the word. That's the word. Yeah. Is that on the is that on the is that on the Slack? Does anybody know right now? Asymptomatic transmission.
I don't think that's in there.
Okay. We'll if everybody thinks that that might be something that they want to do. I mean, we're gonna add as many as we can. So we want to be able to research more into that and see what we can say about that, so more people are interested in wearing masks, even if they're not showing symptoms. Um, we could try to do a research into what percentage of Americans are actually wearing masks, and further into that, what percentage of Americans are, or people in general, I guess. I don't know if everybody's from America in here right now, but what percentage are wearing them and what percentage of people are wearing them correctly. Because I've seen, like, you've seen the memes on Facebook and everywhere. You'll see the two characters talking to each other about masks, and one of them's like, "You should wear a mask," but he has it covered like this, so it serves no purpose if it's not covering your nose. So I don't. We could do some research into that and try to promote proper technique in wearing masks, maybe hand washing as well, just making sure that everybody has good information so that they're taking proper precautions. Also, again, well, I don't think papers should be pushing the idea that people should wear masks. This is a bit controversial. I think papers should be unbiased. State the facts. Yeah, you're right. You're right. They shouldn't be. They should be unbiased and not whether or not people should be wearing masks, but instead stating the facts of the transmissions rate with and without masks. That way, people can decide upon themselves. You're right. I get a little carried away with wanting people to wear masks.
I think that's going to be an interesting, I guess, struggle we have to figure out is like how to navigate this without showing any like political aspect, because it's sad, like the whole idea of wearing a mask is political now, but we're gonna have to make sure we tread those waters lightly so we don't meet people who just like are like, oh, you're political, so I'm gonna throw away all of the science and just focus on that. So that's something we're gonna have to make sure we do well.
Yeah, I agree. I fully agree. I think that was one of the first comments I made into the group, or maybe halfway through. I don't want it to be political in any sense. I want it to be something that people can look at and not have any sense of political polarization to it, and not just disregard any of the information we generate just because it says it leans towards one way. Whether I don't want that. I want it to be good information that everybody can easily digest and can make a decision for themselves. Because I mean, that's supposed to be how medicine is in general. It's supposed to be the patient can choose whether or not they want to do something. They can go against medical advice, and even if we don't think it's a good choice, then they can still, it's their life, they're right. I don't know if we have a topic in there with this, but we could try to research the statistics or the transmission rates of different instances where people wear masks, the people that are asymptomatic, the people that are symptomatic, people who don't have, people who are healthy, because there's a lot of infographics about it too, but people who are healthy, who are wearing masks, what percentage of those people could still possibly catch it from other people, how well the mask is actually protecting them themselves. And then if somebody is wearing a mask that is a carrier, is symptomatic, versus like in proximity to somebody who's not wearing a mask, what is the probability of transmission between those two? And then both of the people wearing masks, and then both of the people social distance. All the things that we've seen on social media, the actual statistics associated with those instances, those certain circumstances. Should talk about the impact that COVID has on the U.S. For instances, the businesses that were shut down and the job loss. Yep, we could totally research that if you want to start a topic about that. Just like I said, anything's fair game. Any type of research that you want to promote is fair game, and it still needs to be neutral and everything. That way, we don't get into a whole political debate, like you were saying earlier. So, fair game. We could still take another look at the medications that are being produced right now, the ones that are being pushed. If anybody has any ideas towards the medications, or anybody wants to do a topic about medication. We could look at the transmissions rates based on age, the death rates based on age again, to see how it has changed since this first started and what the new information shows. We could also research, like I know there's healthcare workers in the group as of now, and there's people that could submit their stories of how they view it as it is and give their own personal statements, which we could share. It's not necessarily research, but it is personal statements. Not they can't be political again, but any type of firsthand experience would be good to speak about in our organization, just to give a bit of more personal outreach towards everything. I think so. I don't know if everybody agrees with that, but I think that would be helpful to showing what the actual disease has an effect on in hospitals, how healthcare workers themselves are having to go through this whole thing, as it is novel, and they have to go through seeing patients suffer and even seeing their colleagues get sick as well. So I think that would be helpful into spreading some sombering information about the whole thing. And we could research, what do you think about a topic that is strictly focused on the psychological, psychiatric effects of COVID-19? Maybe look at were any noticeable psychological issues of those who had COVID-19. And totally fine. We can do psych too. I'll add it to the list as well. I will add it. So we want to do one for businesses affected, job loss, and we wanted to do one about psychiatric.
Hi, Mr. Malaki. I just wanted to ask, with the topic of Asian xenophobia, and especially since I live in like New York City, it's one of the most hardest stricken areas of COVID-19. Would a topic regarding xenophobia against different communities around my, like where I live, be a good topic for this research?
Yeah, like I said, anything's fair game with the organization. It's not just for COVID. It's not just for medical. It could be businesses, like RB was saying. It could be businesses. It could be. I'm not saying that psychology or psychiatry isn't medical, but it could be anything. It could be anything at all. So, what do you mean by a research? What would that encompass? A research topic in the xenophobia of the Asian community?
I guess I can talk about the increase in like biased discrimination towards certain people of races, especially since uh, the virus originated in Wuhan. The different perceptions people now have of racial identities as compared to pre-COVID time.
Yep, that'd be totally fine if you can find a good like you were saying. You were already getting on to a good. I guess I don't know what I'm trying to say. A good point of the whole research. That's what I'm asking is like, what would be the main topic? Like, what would be the overall subject that you're trying to get across, and you stated what it would be. So that would be good. Be totally good. We just have to start a group in the Slack so we can start that, and I'll start to open up these groups. If anybody has any suggestions towards different topics, please submit them to either directly to me or to the email, and I could start opening up the channels in the Slack.
A quick question. So for next times that we may meet again, like through video call right now, are we gonna be through Zoom, not through here anymore?
Yeah, we'll be through Zoom. As long as I'm a student with one of the colleges, we'll go through Zoom. And then if not, then we'll. I'm sure Josh probably has an account with Zoom too, because he's the MD PhD candidate, so he probably has an account. I could have asked him for it. I just didn't think about it because I'm not thinking about things. But we'll go through Zoom because everybody seems to prefer Zoom over this, and it seems to work a bit more consistently than this. I was just looking at something that might be a little bit cheaper than Zoom because I looked at the prices at Zoom, and it's pretty expensive for an individual to be running it.
Yeah.
It's quite expensive. So that's good. I have to head out. Okay. Yeah, I saw. Okay, that's good. Other possible topics that we can talk about is we could look into what actually happens to hospitals when they reach capacity. I myself don't necessarily know what would happen in the U.S. with all hospitals at max capacity. We've seen it in like Europe, where or I think it was Italy. I'm not quite sure, where they reached max capacity and they were having to pick and choose which patients got treatment. Basically, had to choose which patients lived or died because they didn't have enough room for them. They didn't have enough supplies for them. And I think if we hit on that more, that people will take it a little bit more seriously. I know this is supposed to be non-polarized, but I feel like the goal of research should be to enlighten people and to help them make choices, but not necessarily influence them completely. They should be able to make their own choices, but we should be able to give them the information of which to make their own choices. And hopefully they would make a more considerate choices in the long run of things. We could look at the percentage of transmission by providers because we know that providers are getting sick. We know that the transmission. I'm not sure of what the transmission rate is necessarily providers, but we hear about the people dying. We don't really hear about any of the providers dying, and we know that this novel virus hit pretty hard, and the providers had to adapt very quickly. And I'm sure there was increased burnout, increased depression, increased everything like that. So along with the percent transmission to the providers, we could look into the again, harkening back to that suggestion earlier, we could look at the psychological aspects of the providers that were affected by this disease and how that might affect burnout for those providers and how that might affect us losing providers in the future or anything like that. If y'all want to keep talking about different ideas that I was having, or if y'all want to submit more ideas, then send some messages in the chat, or we can stop for now unless anybody has any questions, because I don't know if y'all want me to continue reading the random ideas that I had throughout it.
La de Marimar.
Ah, ya.
Marimar era la novela, ¿no? Ahí de esos perros pulgosos.
Por eso se acuerda, porque se llama Mari.
Mari. Ese es de Gaudi.
Ah, legal.
Le decimos aquí al portón.
Ah, no es así, ese es diferente.
Las ventanas de allá de la casa y la puerta de la otra casa.
Este es más grande.
There we go. No offense. I just don't know if anybody wants to hear. So do y'all want to keep talking about the ones that I have, or y'all want to leave, or we can end it right now if y'all want. I mean, there's just going to be more of the going over the possible topic choices, and I think we covered what our plan is right now. I wanted to get into starting a mask infographic. I wanted to start that, but I don't know if that would be something that we could start right now because we're still a bit spread out with everybody and we don't have specific leaders for those groups. I could talk to them individually and see if we can push just like one infographic out if they have enough information regarding it. But if that does come out, we'll share it with the group and we will get everybody to start sharing it on social media so we can spread better information. Brought up, but how about research on COVID as affected remote learning? That's a good one. That's a good one. I like that one. How COVID-19 has affected remote learning. I do like that because like right now we're having to go through Zoom to do all this. And I mean, I'm introverted naturally as it is, but with COVID, it could be, this is the norm now. This could be something that's a bit more normal in society, and that we just start using Zoom for most of our social interactions. And then how is that going to affect us down the road? We could try to look at instances in where isolation is still here, and we could theorize that we would have higher depression. I mean, this would be all theory. This wouldn't be really research, but it's just interesting to think of. Yeah, if we have anything that comes out from those groups, I think we would be talking to the article sifters and the we could probably put a lot more people in the article sifting group. That way, just a whole lot of articles we put out. I mean, they're not necessarily going through each article and tearing it down all the way and analyzing it, but if we had more people, that'd be very helpful. That way, we wouldn't have to have the the other topic groups, having to spend time to look at different articles, different databases. Should we submit our topic along with our CV to apply for a leadership position, or are the two different? I would do them differently. I would submit them differently. That way we don't miss it while we're looking at your CV. I mean, we're going to look at your whole CV, so we shouldn't miss it. But I would think that it would be better just to submit them separately. Okay, I think I hit on everything. Josh should be, I don't know when his qualifying exam is tomorrow. I don't know when he's separate attached. I would say a separate email entirely, or a separate message entirely, just so they're separate. I know that's a bit more tedious to do another message, but I think it would be seen quicker if we saw it. Because it's still going to take us a while to go through all the CVs, and if we're going through all the CVs individually, and we might just not see it for a while before we take a look at a CV, specific CV. Yeah, Josh, I don't know when his test is tomorrow, so I don't know if he'll be back like early tomorrow or if he won't be back tomorrow. If he'll just be back on Friday. But after his test tomorrow, he'll be back, and he'll have a lot of time. Or when I was messaging him, he said he would have a lot more time for us. And Josh is again, for the 15th time, he's an MD PhD candidate, and we were volunteering at the geriatric home, and during that time he was also a mentor for those who had an interest in medicine, and he has good information about admissions with medical school. So anybody that's interested in that, you could also start when he comes back. Not now because he's trying to get studying and focus. But when he comes back, we could probably open up a topic section where people could ask him questions as well about medical school. If we could try to get some of his people, his colleagues, his fellow students to talk about it and get those medical students to start presenting something during these meetings, or just having them in the Slack topic chats to answer questions of anybody and put y'all into contact with them. That would be helpful. I think if he could do that, that would be helpful. I'm sure he try to do something like that. How or where do we apply for a leadership position? So when you submit your CV, you can tell us if you want a leadership position or if you want the opportunity to be a part of a review article, or you can say both. Either way, you just tell us in the email. And if not, we'll just probably email you or message you and ask you if you want a leadership position if we choose you. So I mean, you don't really have to, but if you don't want one or the other, or if you want one or the other, then you can tell us in the message. Is there anything else that anybody wants to add? Okay, if nobody has anything, oh, sorry, I didn't see your message. If we don't have research experience, can we still send in our CVs? Yes, but I'm going to say now that you may have a less likelihood of being chosen for anything. It's not that you're less valuable to the group. It's just that if we're going to choose leadership people, then we need people who actually have the research experience, because that way, if somebody doesn't have research experience in the group, then they can talk to the leader and try to get some help with how to do research. And I think we've hit some good points. If anybody has any more questions, you can either say them now or you can email me later. And if that's everything, I think we can call it a wrap. I think that's good. So thank you all for coming to watch. Thank you all for being interested in this group and wanting to better your communities. I hope this group is something that could be long lasting and can grow into something more than just outside of COVID. And I hope that we can start putting out information that's good for our fellow citizens, fellow people. I think we can make a difference and save some lives with this. So thank you guys. I will see you guys Saturday. That's when the next meeting will be, and it will be on Zoom. I will host it over Zoom. So.
Oh, the link for that meeting, is it on the website too?
What about the website?
The link for the Saturday meeting?
Oh yeah, it'll be on the website, yeah.
Okay. And it's gonna take place Saturday afternoon or morning, evening?
It'll be a Saturday afternoon. When I was looking at the poll, it looked like the most people wanted was at 7 p.m. SDT, or CDT. So that'll probably be it'll be about the same time as this one was.
All right, thanks.
And this meeting will be posted on YouTube for anybody that wants to come back and watch it and go back over it. So hopefully I can get better at this. So forgive me for the stuttering and everything. But thank you all. You're all great people. I hope to see you in the next meeting. I'm going to stop recording.